Excellent. Excellent. So with that, everyone, thank you so much for being here. My name is Asata McKenzie, and I'm joining you from the University Health Network, also known as UHN. On behalf of the Healthy Hospital Working Group, I want to welcome you to Optimal Sleep Health. Before we get started, I want to quickly highlight the QR code that is on the screen. This QR code is a brief feedback form about today's session. So please complete the feedback form before you leave today so that you get entered into our prize draw. At the beginning of November is when the prize draw, you'll find out who wins, as you can see there on the screen. I'm going to be displaying the QR code again at the end of the session, and I'll be posting that in the chat in a moment. And now I'm going to pass it over to Abdel for optimal sleep. Thank you again, Abdel. Really appreciate you.
Thank you, Asata, for your invitation and nice introduction. And good afternoon, everybody. I hope you all can hear me very well. So my name is Abdel Basat Al-Hawari. I am a clinical research study coordinator at Toronto Western Hospital in the anesthesia department. On behalf of Dr. Mandeep, he sends you all his regards, and unfortunately, he won't be able to join us in this session. So we'd like to present a brief information about the study we are conducting nowadays. And as part of this program we have today here. So this is regarding the sleep health and wellness, mainly targeting the healthcare workers in working in frontline agencies or frontline like settings and dealing with patients in Canada only. So in all provinces, in study actually is aiming asking their participation. Next, please. So in this, like a brief background of the study, we all know that as healthcare workers, we are working in different settings. And before the pandemic, actually, we all as healthcare workers were like facing lots of stress related to so many factors. And there are so many studies talking about kind of stress and what sort of factors that affect the healthcare workers, mainly how it affects their sleeping pattern. So here, this slide talks about as a medical expert who has like lots of roles in his life as a manager, as a health educator, as a schooler, as a professional, as a communicator, as a collaborator. Of course, this like goes to all healthcare workers, not targeting only doctors, nurses as well, they are doing the same. Next, please. What this may cause or what this leads to, unfortunately, it may lead to like physician burnout. And when I talk about physicians here, I don't forget the role of the nurses and other professions as well. So these factors or these effects targets or impacted the the outcome of all the healthcare workers in Canada, leading to burnout. That's why you see all these burn matches, and these matches or this burnout differs from one person to another. See, one of the matches is totally burned out, and one match is still surviving. Next, please. So as healthcare workers here, the problems with the insufficient sleeping or those who do not have like enough sleeping times, this may cause to patient safety incidents and causes like medical errors. And this also may lead to low professionalism among healthcare workers. And also it reduces the patient satisfaction in general. Next, please. So here we talk about the sleep health. What is sleep health? To define sleep health here, how can you define sleep health? Does it matter? Sleep health here goes to different like definitions. It goes here to sleep duration. So this will be like expressed by the total amount of sleep per 24 hours. It may go to sleep quality, which is subjective assessment of good or poor sleep. It may go to sleep timing, placement of sleep within 24 hours. It may also affect the alertness, the ability to maintain attentive wakefulness. It also may go to sleep efficiency, which is the ease of falling or returning back to sleep. Next, please. Sleep disorders. There are so many sleep disorders. Some of them here are given by examples like narcolepsy, periodic leg movement syndrome, involuntary movement of the leg during sleep, restless leg syndrome, insomnia, obstructive sleep apnea, hypoventilation syndrome, and central sleep apnea. So these are examples of sleep disorders. Next, please. All these sleep orders may affect also the human body. These are the parts of a human body that could be affected by different kinds of sleep abnormalities. Like, for example, the memory here. The memory will be affected. You will start like forgetting, or the healthcare workers under pressure of insufficient sleep time would be complaining of like some memory loss or affection of his sleep that affect his memory. Mental health, taking decisions, immunity system would be affected, metabolic syndrome as well, low libido, mortality rate. Then here the cognition, the accidents would be increased, and hypertension also, weight gain, heart disease, balance and coordination. So all these, see, the human body is affected by the sleep disorders that the healthcare worker may face in his profession. Next, please. This is a study actually, and go next, please, Sata. Next slide. In this study, in the GCSM, this study highlights that more than 50%, see, this is a very big percentage of physicians, workforce, and mid-career are at high risk. See, imagine, more than 50%. This is a very high percentage. So this would cause like insufficient recovery sleep, sleep interruptions, long hours, high workload, and shift work. Next, please. Now, we were talking about the situation before the presence or the appearance of the COVID-19. Now, the COVID-19 and the pandemic added even more pressure on the healthcare workers, and they started having more complications and more sleep disorders. You can go next, Asata. Next again. So the healthcare workers were very worried. Now, because of the like low timing in sleeping hours, now the pandemic added even more stress to the healthcare workers. They start thinking about their families, and they start thinking about the isolation techniques and how to deal with patients. And then they start thinking about, I'm not going to like get a infection in order to go back to my family and then infect them. So they will start thinking more and more, which affected definitely their sleeping patterns and the sleeping hours. Next, please, Asata. Now you can see the situation here between this photo and the other one. Here, the optimal mental health is affected and it is alerted. See here, the healthcare worker is burned out and is explained here. The health-related quality of life also is affected, while before it was like there was patient safety, there was some sort of professionalism, and patients were satisfied compared to the situation after the pandemic. Next, please. So from this background, actually, I just highlighted briefly the background and why we have this study. Our study here talks about the healthcare workers cognitive behavioral therapy study for Canadian healthcare workers. And it is cognitive behavioral therapy for insomnia. So this I is for the insomnia. Next, please. The fastest way. So the title of the study is to evaluating the effectiveness of the digital cognitive behavioral therapy for insomnia, CBTI, in frontline healthcare workers, the HCW, Healthcare Workers CBTI study. It is a two-arm, pragmatic, prospective, parallel, randomized, controlled trial. Next, please. Now, from the background I showed you, there was like a recent sleep issue of the UFT magazine article, which is called Make Up Call. If you can press on the link, Masata. It's not. Yeah. Thank you.
So I'm wondering if people can see my screen. Is it, do you see the wake up call and the U of T or not yet?
No, I can't see it.
Okay, so I'm going to stop sharing and then reshare this new screen.
Okay.
Yep, 1 moment.
Yeah, thank you. Can you scroll down, Sata, a little bit?
And you can see this now, I'm assuming?
I can see it. Yeah, just scroll down, please.
Sorry, can you hear me? Can you see me?
I can see you, I can hear you,
I
but
can't
I
hear
don't.
you.
Can you hear me?
But I'll continue to share. Share window.
Can you hear me?
So please let me know if you can see this.
I do see it. Can you hear me, Asada?
You can see and hear. Okay. I don't know why no one's responding, but I'm glad you can see and hear. So I'll go back to sharing it again. No one else seems to be responding. So this is Abdul, what you asked me to share.
Yeah.
So I'll just
Yeah.
roll through that.
Scroll down, please, a little bit. Only this part of the paragraph again, a little bit more.
So Abdul, I cannot hear you.
You cannot
at
hear
all.
me. I can hear you.
You can always leave and come back again. Sometimes that helps with connection.
Can you hear me now?
There. You muted and unmuted, but we still can't hear you.
Can you hear me?
Yeah, I think it's a technical issue.
No.
We can hear you.
So there's a big red button at the far right-hand corner. Just click leave and then come back. And in the meantime, we've got a hand up. Do you want to unmute and ask your question?
Yes, we were actually able to hear him okay.
Wow, I can't hear you either. This might be a technicality on my side. Someone use the chat. Let me know if you can see the screen I'm sharing. You can hear both. You can hear both. You can hear both. You can hear him. Okay, then it must be it's my problem on my side then. Apologies, you're able to hear him okay. But it seems like I can, yes, so the problem must be me. So I'm not hearing anything. So I will just mute myself and I guess if Abdel, if your camera is on, if you're still here, if you can just give me a thumbs up,
Can you see me? Can
then
you
I
hear
will
me?
know to change or roll
Hello?
through. I'm so sorry, everyone. I really
Hello?
can't hear anyone.
Can you see me?
Mm,
Hello?
I can-
I'm back.
Yes, so I can see that your hand is up, but I can't hear anything. I apologize. Feel free to continue. If everyone can hear, then it's only on my side that there's a problem,
Can anyone hear
it
me?
seems.
We can hear you.
Yes, we can.
All right.
Yeah, we
All
hear
right.
you.
So, Abdul, please continue and give me a
Okay.
thumbs up when it's time to switch, roll through this, what I'm sharing right now.
Okay. Okay. Fine. Now, since everyone can hear me,
I'll just
except
scroll through this
Asata.
page so people can see the page that's available.
Yeah. You can have a look at this page, actually. It is a study at UFT, and I just wanted to show you the statements of Dr. Mandi because he was like mentioning and targeting the need for having this study and why it is important to have people and especially the healthcare workers participate in this study. But unfortunately, Asata cannot control from her side. Anyhow, you can just refer to this article and since the presentation will be recorded, so you can refer to it later on. We'll go to next slide here.
Great. So a thumbs up
Yeah.
if you're ready for me to go back to the slides. Or shall we stay
Yes.
on this page? Okay, I guess that's the symbol. Yes, good.
Okay.
I'll stop sharing. Here we are back at the slides again.
Can you see me, Asata?
Do you want me to click on this as well?
No, just leave
No.
it. Can you?
Okay,
can you hear me? No, go back. Okay, so let's now, here we mentioned a little bit about the purpose of the study, and this study will use the digital cognitive behavioral therapy for insomnia program, which is named Sleepio, to conduct a Canada-wide randomized clinical trial amongst frontline healthcare workers to determine the effect of digital cognitive behavioral therapy for insomnia program on their sleep health, mental health, wellness domains, and overall health-related quality of life. Now, this cognitive behavioral therapy program, which is named the Sleepio, was approved and implemented in UK, but not yet in Canada. So by this study, we hope that if this program proves its efficiency here and effectiveness, then maybe people can go and subscribe to this program. I'll ask Asata to go next.
I can hear you now, by the way.
Oh yeah, good. Thank you. So these posters here, we made these posters for the media. If you are a healthcare worker and you are working or you are experiencing insomnia in your work, then you are eligible to participate in this study. Next, please. So what is involved? With increased rates of burnout and subsequent insomnia experienced by healthcare workers, this study aims to evaluate the effectiveness of a new technology program. Engage in remote and virtual participation using an internet-enabled device to access DG-CBTI for 12 weeks duration. Improve your sleep health, pain, and overall health-related quality of life. Next, please. So in order to participate in this study, you need to meet these inclusion criteria. You need to be a physician or a nurse or any healthcare worker. You need to be involved in frontline management of patients. Of course, in order to participate, you need to suffer from sleep problems. I don't say that you have to, but if you have any sleep problems, then you are eligible to participate. Are English speaking, of course, have access to a mobile phone or computer with internet. Next, please. So as I said, some of the inclusion criteria before, you need to be an adult above 18 years of old, a healthcare worker with probable insomnia disorders as indicated by score of 16 or lower on the sleep condition indicator. This is one of the indicators that once you participate, then it will show in the baseline data. You will do that sleep indicator. If you got a mark of 16 or lower, then you are eligible to participate. If you got the score above 16, then you are not eligible, but you will receive like some education pamphlet to tell you some information how to manage and how to overcome the sleep disorders if you are complaining of any of them. You need to be involved in frontline management of patients with COVID-19. Of course, now we don't have, or maybe it is still there, the COVID-19, but it is not like before. But still, for those who are like at the front line or dealing with patients with COVID-19 or other situations, then you are eligible. English speaking with access to mobile phone or computer with internet access. Next, please. The exclusion criteria for the study: participants who require urgent cognitive behavioral therapy treatment as per their healthcare provider, or those who have received cognitive behavioral therapy in the past 3 months, and those participating in other psychological treatments and or drug trials during the study, these are excluded from participating in this study. Other significant medical or psychiatric conditions like life-threatening cancer, neurological conditions, epilepsy, severe depression, or active suicide intent, pregnancy, or breastfeeding. Again, these are excluded. Inability to fill out self-report questionnaires, study materials, or follow the instructions of this study. Next, please. Now, once you agree to participate in this study, you will be consented by signing an electronical signature, consent form. After signing that consent form, then you will be answering some questions and doing the sleep indicator score. If you got the required score, which is 16 or below, then you are eligible to continue the other questionnaires before the randomization stage. Once you reach to the randomization, then you will be randomized, of course, like electronically, and you will be like distributed to either one of the arms of the study, the intervention arm or the control arm. For the intervention arm, you will be getting access to the digital cognitive behavioral therapy, which will be offered by using the Sleepio website. And for that, you will be getting a code, a special number, in order to get access to the app itself, and then start receiving daily sleep diary. At the same time, you were consented to this study. So, for example, if you were consented at 6 p.m., then you will start receiving the questionnaires every day at 6 p.m. at the same time you were consented. Now, if you are consented, or if you are, sorry, randomized to the control arm, then you won't be able to use the Sleepio, but you will be receiving again every day an educational like instructions you need to follow for a duration of 12 weeks. After you complete the 12 weeks, then you will get a code, a special code. I will give you the code. And for that code, by that code, you will get access to the sleep app itself for another 12 months, for a whole year. So both arms, like both groups of the study, will benefit from using the app, the Sleepio app, for 1 year for free. Next, please. This is the flow chart of the study. Once you are consented here, then you will be screened by doing or answering the questions and see how much you will get score in the sleep indicator. Then you will continue the database till the randomization. Before the randomization, you will continue doing all the questionnaires. Once you reach to the randomization, you will be randomized to one of the arms, as I said, one of the either the intervention arm or the controlled arm. Sorry for the small typewriting here. And then once you are done with the study, then you will receive a compensation gift card of $50. This is the poster for the study, and Asata, I've sent you like a separate poster with the original size for dissemination if you want to
Yes.
distribute to all the settings.
Okay.
Once you see this poster, there's a link here. You either visit the link, which is here highlighted, or you just scan the QR code, then you are in, and then you start like following the instructions till the end of the study. Next, please. Uh, I put some references here at the end. Next, please. You can show the references. Some useful resources here. You can visit them anytime and get more information if you are looking for more details about the background of the sleeping disorders, and hope you may like get the answers for all your questions if you have. By this, I come to the end of the presentation, and now the floor is to you, Asata, if anyone has any questions.
Excellent. For the quick Q&A portion, I'd encourage you to use the chat or unmute. And while we're just waiting, give me a moment because there are some really useful links, information that you shared. I'd like to put some of those links in the chat as well. I'd also, if you don't mind, Abdi, I have a summary of the sleep study that was done previously and an infographic that was created as a result. Would you mind if I shared that infographic with everyone before they get into their questions?
No problem. You can share.
Fabulous. So I've stopped sharing, I hope, and I'm going to share something else now. So hopefully you can see this. It's not in slide mode. If you want to talk to anything that you see here, please let me know. So in summary to what was done in the past, and in encouraging everyone to consider being a part of the current sleep study, the infographic that was created by Dr. Singh and Dr. Hawa includes ways to prepare for a good night's sleep. This is either during the day, 1 to 2 hours before bed, or bedtime. Did you want to speak to anything here on this slide, Abdi?
Well, actually, I didn't go to that because
Okay.
they would see all this once they scan the the QR code, and if
Okay.
yeah, for the control
Okay.
group they will receive all these instructions, and even for those who are not eligible to continue with the study, they will receive this infographic with all the information inside it.
Excellent, excellent. Okay, then I'll just continue to highlight in closing.
No
These are
problem.
signs to look for. This is information that you can receive. Again, you see it here, and you may want to remember or share, and you can do this again through the instructions that Abdi gave. So just taking another quick look, there are daily tips, there are tips for night shift, and even if you don't work night shift, still, I think some good information here, and that's all I'll share as far as that goes. So now, again, I can't thank you enough for being here. Does anyone have any questions or comments about what they experienced here today? Again, feel free to raise your hand, unmute, or type your question in the chat. If there are no questions, that's fine too. We'll share information. The last bit of information I'll share with you is just the information that we started with, and that was thanking you and encouraging you all to consider scanning this QR code, clicking the link that I'm going to put in the chat for this session. Please give your feedback, and also please take note that you can win prizes as is said on the slide. And I also want to let you know when our next session is. So I am having lots of technical difficulties. Thank you for your patience. I'm not able to click anymore. For some reason, my mouse is disappearing. So I will just share that the next session will be pet therapy, and that'll be on October 17th from 12 to 12:45. We really, really, really hope to see you there. And let me try one more time. Yes, I've got it now. Sharing this link with all of you. Trying again one more time. What a challenge today. Chat. Right, and there's the link. In the chat, one question, can we see the slide prior with the references? So I'll show you that slide as well. Go back to sharing, slide with the references. So here comes the slide with the references. Here you go. So feel free to screenshot that, take a picture. And just in case there are others you wanted, I'll give you another 10 seconds here. And then even more information here on this slide. Some good online resources. And I think there was one more. Yeah, this one. Any closing words, Abdi?
Thank you so much, everyone, and I hope you will be able to manage your sleeping disorders if you have any, and wishing you the successful days, and take care of yourselves as healthcare workers, because uh, you are the soldiers working behind the scenes without being maybe recognized, but it's okay. As long as you are satisfied with what you are doing, then you will be good. Thank you everyone for your good listening.
Fabulous. Thank you. And just one more note, someone's asking, how do you access the QR code? You use your smartphone, point the camera to that QR code, and then the website will come up. But there's also the link that might be easier for you to cut and paste it, that I just put in the chat. Might be able to do that again. There's the link. So you can always click on that or cut and paste and put that in your web browser. All right, with that, thank you again, everyone. We look forward to seeing you at the next session, and take good care. Bye for now.
Thank you, everyone. Thank you, Asata.
You're welcome. My pleasure.
Bye-bye.
Bye-bye.